All right. Thank you, everyone, for giving me this opportunity to share some information. I'm starting here on the ASTDD website because it has some really good resources that make it very easy to go to other websites. So this is our homepage right here. And if you click on this A to Z here up at the top, and then you click on D for data, and you click on the very first link at the top, which is data collection, assessment, and surveillance. That's actually the homepage for our data committee. And there are a lot of good resources on this page, but two in particular that I wanted to call your attention to is under the ASTDD Basic Screening Survey Resources. We have a link to a document that's called States with BSS Oral Health Data. And on that particular page, which I've already downloaded here, we have a list of all of the states and DC, and it lists here any of them that have done a basic screening survey for Head Start preschool populations, for third graders, for older adults, and if they've done one that combines BMI, body mass index, with the BSS. And so you can scroll down to see if your state has done one. And when available, we've actually included links to the actual reports themselves. So you can look at the full report for any of these ones that are highlighted here in blue. So a lot of folks, I get questions all the time, what states have done a basic screening survey on third graders? And well, this is a very easy place to just go ahead and find all that information. Then, going back to the website, the other really key document that I wanted to share with you is the State Surveillance Data Resource Guide. And this lists all of the 36 indicators that are part of the National Oral Health Surveillance System. That's a set of indicators that has been vetted and approved by the Council of State and Territorial Epidemiologists. And with that document, you can, they have three tables in this document that sorts the indicators either by topic area, and as I say, there's 36 of them: access to care, oral health outcomes, and community interventions and infrastructure. Then you can also look at them sorted by population. So if you're particularly interested in, say, Head Start kids, here's indicators that are specific to Head Start kids. And then in the third one, we have really detailed information in this table that talks about, as I say, really gets into the details. But what's really nice about this particular thing is that this table has links to all of these different data sets here. So it makes it very easy to find the information that you're looking for. So those are two key documents on the ASTDD website. And as you can see, just on this data page, we have a lot of information. So the next place I wanted to take you to is the CDC Oral Health Data Portal. And this has indicators for some of the National Oral Health Surveillance System indicators, not all of them. But what is nice about this page is that you can explore the data by location. So you can pick a state from the drop-down menu here, or you can look at the data by indicator. So, for example, for adults, I probably have so many tabs open that it doesn't it's taking a little while here, but you can look at, here it is, it's coming up. It's giving you information for different states and for the whole United States for adults. So I really, really like this website. As I say, unfortunately, it doesn't have all of the NOS indicators, but you can look at all of the information for a state or all of the information on a particular topic. And a lot of people are not aware that that is so readily available. On the ASTDD Data Committee webpage, we have a link to a webcast that we did in partnership with CDC that goes into a lot of detail and specifics about how to navigate this website, because this is kind of, what can I say, only the tip of the iceberg. You can actually go into a much more in-depth section of the data portal where you can do your own types of searches, and which is really useful if you're looking particularly for doing research or reports. Another website that a lot of people are not aware of is this is the Medicaid Medicare CHIP Services Dental Association. And when you go to this particular section of it, which is the data section, you can pull up all kinds of Medicaid information about states, like what type of CHIP program they have. I was just wanting to hover over there. You can see who the state contact is for the dental program, the state Medicaid dental program. You can look at things like in the financing about the budgets or what their payment methodology is. Policy and benefits describes all, you get detailed information about what they're covering in these different areas. And one of the things that, let's say I just go on, well, let's go on policy and benefits, and I click on preventive. It says you need to log in to view this content. Please log in. If you click on please log in, now I'm actually a member, so I can get into it, and I have a permanent password and username. But you can actually just type in your email and you can get a temporary access to the website so that you're actually able to look at all of the data that is contained in this website. And then the last one that I wanted to call your attention to is the ADA Health Policy Institute. And particularly if you're looking for workforce information about dentists, the number of dentists in a state, there is a lot of information that is available on this website. And Marco, and I cannot pronounce his last name, but Marco at the ADA, at the Health Policy Institute, is really happy to work with you to provide you with customized data for your state. I've found them to be really, really easy to work with and very, very helpful. So for people who say, you know, I can't find data for my state, these are really 4 different websites that you can go to that provide you with a lot of information that you can look for. So at this point, that was very quick, and I know these are supposed to be quick, but I'm more than happy to answer any questions that anybody has. And Francis, do you see anybody chatting or?
Currently, there are no questions in the chat box, so anybody that is using BlueJeans from their window can open up the chat box that is in the upper right-hand corner. And then anybody that has called in on the phone, everybody is currently muted. On the phone, you can press *4 or go onto the participant button on BlueJeans on that window and then unmute yourself. And so I have one comment that says, Francis, it says you are Matt. I'm not Matt. Then we have a question from Cheryl. Are there any sources of information on Medicaid managed care contract provisions that include oral health?
And I will tell you that I am not an expert in that area, but if that information is available, it would be on the MISDA website. I am looking to see, go back here. It does say that there is information about the administrative models that are used for each state. So does that answer your question?
If you are showing it on your screen again, you'll have to go back to share screen.
No, I wasn't sharing it on my screen, but I was going to say that yes, on the MISDA website there is a one of the drop-down menus is administrative models, and it talks about what the managed care model is that they're using in that state.
Sure, and Cheryl is responding that she does not think MISDA has details yet, but wonders if the dental directors might easily know.
I would say that most state dental directors will know what is being done in their state, but I would think that Mary Foley and Marty would be the real experts on that.
Great. And then from Brenda, she says, thank you, Christine. And would it be possible to get a summary of the resources that you just showed us, and it could be kept for easy and quick access?
Well, I have already posted on SOCIUS, the State Surveillance Resource Guide, a link to that. And I think I have posted also the states with the BSS data, but I could easily make a PowerPoint slide with these links to show you, so you could, easily access the websites. I did just remember that there was a third thing that I wanted to show you. And let me go back to sharing my screen.
And while Chris is doing that, I'm happy to commit to putting together this list of resources, and I'll post it both with this recording, and then we can send it out as a network-wide announcement that'll just include hyperlinks and a brief summary as Chris detailed for us today.
And the other one document that I forgot to show you is that every year ASTDD does a survey of all of the state dental directors. And on the public side of our website, we do post the aggregated data with the information from the state synopsis. And on the members only side of our website, we have the information broken down by state. And so we have very good participation in this. This last year, the only state that didn't answer was Maine, and they now have somebody in the position of state dental director. So I fully expect we'll have 100% participation next year. But we have information about the NOS indicators. We have information about school-based health centers. There's demographic information, infrastructure information. I'm scrolling down here some more so you can see we have information about the workforce, about the actual administration of the state oral health program, about the state's surveillance system, and then about programs that are funded or operated by the state. So access to care, dental screening, dental sealants, etc. And as I say, this is in the members only section of our website, but anybody who's interested in dental public health is welcome to join ASTDD as an associate member. So that's my plug there too.
Great plug. And then another question we have, what have you found are the best ways for finding accurate locations or county level counts of practicing dentists?
Well, I wish I had my data expert, Kathy Phipps, on the phone with me because Kathy and Mike are really our two experts in terms of data. County level data is a lot harder to find, and I'm sorry, I cannot answer that question. If you want to send it to me by email, when Kathy is currently gallivanting around Africa right now, when she gets back, I'll be happy to forward that to her and see what she can share with us about what she knows about county level data.
Great. And then do you have any best practices advice on how to encourage state agencies to better track oral health data? We are unable to show oral health benefits, improved outcomes because our state's health data is so general, it's useless.
We do have a best practice approach report on our website about, and we just updated it, about data collection and surveillance. And it has a lot of really strong rationales and good examples of why states should be collecting data. Again, that's one of those questions where if you wanted to talk with me offline about your particular state, I'd be happy to see what I can do to help you. I can't hear you, Francis.
Sorry, I was still muted. If there's any other questions, we can wait another couple of minutes. And keep in mind, you can also unmute yourself if you want to speak out loud. And if you're on the phone, you do that by pressing *4.
And my email is cwood@astdd.org. As I said, I'm happy to communicate with folks on an individual basis too about specifics.
Hi, this is Nancy Shankarappa from Ohio. I did not do my attendance when I started the webinar. I just wanted you to know I'm online.
Okay, thank you.
Okay, and I do have a question about the data collection. How detailed data do you collect on the oral health? I'm kind of very new to the project. I'm a new grassroots person from Ohio. How much in detail do you collect it? If you have something, and if you can forward it to me, I'll be glad to take a look at it. Because data desegregation is one of the issues we have in the Asian population.
So some of the data, like particularly the basic screening survey data, we do have states report that by race ethnicity.
Okay.
And for example, when Hawaii did theirs, we really had to work very closely with them to break down the population groups that they wanted to pull the data from, because they have some significant population groups that are not commonly found in other states. And they really needed to get into the nuances of that data. So we're able to work with them to do that. In terms of some of the data sets such as BRFSS and YRBS, it's probably possible, but the limiting factor is the cost of how much, how much is it going to cost to break the data down into that level of detail.
Is it a desegregated data within?
I'm sorry, I couldn't understand that.
Is the data desegregated? Like, let's say if they're from Africa, does it say which country within Africa they're from?
Oh,
I
only deal with U.S. data. I don't have
okay.
any international data. Sorry.
Okay. All right. That's okay. That's okay.
Okay, and then finally, Chris, we have a couple comments saying it's very helpful and thank you, and that the participants today will want to take a look at the data and work through it a little before knowing if they have any questions. So I'm going to include your email and contact information along with the recording of today's presentation. It will be posted on Socius under the forum Take 20 with the network where all recordings are posted. So, and then once we have a summary sheet of everything presented today, I'll send that out network wide as well.
Okay,
So-
and I actually have a summary sheet I put together, so I'll just send that to you. So, all right. Thank you
Well,
very much.
Okay. Thanks, everybody.